Okay, sir. We are live on Facebook now. So, very good evening, good afternoon, and a warm welcome to everyone who have joined us today. Today, we have two experts on the occasion of World Hypertension Day for our initiative Tell Me More, which is dialogue with the cardiorenal expert. So, on the occasion of World Hypertension Day, hypertension being one of the silent killers, as commonly referred, and also one of the common risk factors for CVD as well as chronic kidney disease. So, in this regard, we have come up with this initiative to bridge the gap and address the challenges associated with hypertension management for the general public, the caregivers, and also to people across India who are suffering from hypertension. So, with this, I would like to welcome and introduce our clinical expert for today. So, we have with us a young and dynamic nephrologist, Dr. Puru Tyagi, who's a nephrologist and a transplant physician with a keen interest in diabetic kidney disease, hypertension, dialysis related issue, and post transplant care. He is associated with Aryavart Hospital and Anand Hospital, Meerut. He is the founder and co-director, Priyadarshini Fertility and Kidney Care, Modi Nagar. And apart from his extensive experience in nephrology and internal medicine, he has also experience in specialized critical care. So we welcome you, sir.
Thank you so much. I'll just have to correct you. I'm not associated with Anand Hospital anymore. It's just the Aryavart Hospital.
Okay, sir. We also have with us Dr. Abhishek Kumar, who's a consultant and interventional cardiologist. He's a gold medalist in DND cardiology from Fortis Escort Heart Hospital, Delhi. He's a director and head cardiology department, Santosh Hospital, Meerut. He's a director, Amira Heart Care Center, Meerut. And he has been formally associated with LLRM Medical College, Meerut, and Rajiv Gandhi Super Speciality Hospital, New Delhi. Thank you so much, sir, for joining. We welcome you for this session.
Thank you.
Thank you so much.
Thank you.
So with this, we would like to initiate the discussion. So our first question would be to Dr. Puru Tyagi. Sir, as you know, a lot of patients are not aware that, kidneys are actually play a major role in regulating the blood pressure. So if you can just throw some light on the part where, kidneys are maintaining a regular blood pressure and what is the importance of its role in that?
Right. So Anjali, as you rightly said, that kidneys do play the one of the most important role in the regulation of hypertension. Basically, it's one of the organs which helps regulate the blood pressure. It has certain specialized sensors which detect what is the volume of blood and when the BP is going low, when the BP is going high. And in accordance with whatever it detects, it basically does some modifications to control that situation. For example, if the BP is going too low, then it has a specialized mechanism where it can retain some fluids and it can make the BP normal again. And similarly, there is more of a mechanism to maintain, to correct the low BP, and not so much of a mechanism to control a BP which is towards the higher end. And this has something to do with our evolution, because historically we have not faced in thousands of years of existence of humankind. These are probably the first 50 or 60 years where we are facing an epidemic of hypertension. So body is just not adapted to hypertension. It just does not know how to recognize it. And that frequently leads to a maladaptive procedure wherein the kidney is actually trying to help. It thinks that it's trying to help. But in the end, it ends up worsening hypertension. So this is basically, to put it simply, it's because it is actually a very complex topic with a lot of regulators and everything. But I hope that I got the message across to the viewers.
Yes, sir. So simply put together, that kidneys play a very major role in regulating the blood pressure. However, kidneys do not know actually that in case of helping, it is actually increasing the blood pressure. So kidney play a major role in the high blood pressure as well as in the development of hypertension is what we come to understand.
Right.
So
That is
my
true.
next question to Dr. Abhishek Kumar is that, sir, how is hypertension related to the cardiac output? How does it affect the cardiac output in patients?
Actually, hypertension and the cardiac output are directly related. As per the equation, mean arterial pressure equals to cardiac output and peripheral vascular resistance. So as blood pressure will increase, cardiac output will also increase. And this is a compensatory mechanism. Sometimes when cardiac output falls, the blood pressure falls, the cardiac output will automatically fall. But as the mean arterial pressure will rise, cardiac output will rise. So these are directly related. So to a certain extent, when mean arterial pressure will rise, cardiac output will be rising, provided that vascular resistance is same. If vascular resistance is decreased, then pressure will fall. So it is directly related to the cardiac output.
Okay, sir. So since it is related to cardiac output, it must be also related to kidneys. So how it is affecting the normal functioning of kidneys? So Dr. Puru Tyagi, if you can guide us on that.
Yeah.
Bilkul.
So hypertension is one of the most important modifiable risk factors for kidney diseases. What it does is essentially it causes the kidney to work harder. Now, in an already compromised kidney, which is barely stretching to meet the regular requirements of the body, it becomes really difficult to accommodate that extra effort just so that it can accommodate the effects of hypertension. So we have individual units inside the kidney called glomeruli. And what happens in hypertensive patients is that the BP, which is elevated, it gets directly transferred to these tiny units inside the kidney. And these tiny units, they can't withstand this kind of pressure for a very long time. And eventually they give in one by one. So in essence, it ends up decreasing the effective uh, functional capacity of the kidney. So basically, it causes a deterioration in kidney functions. So a hypertension which is uncontrolled, and if it stays for a long period of time, and I'm talking about years, then it can potentially damage the kidney permanently. Even hypertension, which is very, very high, something like blood pressures more than 200, 240, 220, something like those, even if they stay for a few days, they can also lead to damage of the kidneys, which is frequently reversible, but it needs to be corrected immediately. And the reverse is also true. Whenever we have kidney diseases which are forming inside the kidney, even before they can be detected on lab investigations, we frequently find that the blood pressure is shooting up. So basically, it's a two-way road when it comes to kidney and hypertension. Hypertension can worsen kidney diseases, and kidney diseases can frequently be recognized by the presence of hypertension. So,
Okay, sir. So basically, it goes hand in hand that, hypertension being a major risk factor, modifiable risk factor for kidney disease, and also kidney disease can be a contributor to
correct,
hypertension. So with
correct.
this, we come to another question for Dr. Abhishek Kumar. So there is a term known as hypertensive heart disease. So what is that and how is it classified?
Actually, hypertensive heart disease is a major term which encompasses the many diseases that can be caused by hypertension. So generally, we say when hypertension is causing the concentric hypertrophy of the ventricles, we generally classify it as a hypertensive heart disease. But it's not true. Hypertensive heart disease comprises a group of diseases that can be associated with rise in blood pressure. So this can be heart failure, this can be myocardial ischemia, and this can be generally only concentric hypertrophy. And these can cause the extensive morbidity and mortality in the patients. So these are just not the simple term of hypertensive heart disease. This encompasses a range of disorders, especially the heart failure and myocardial ischemia. So as the blood pressure will increase, the myocardium, the LV wall, the chambers the wall will increase in size to compensate to pump the blood against the blood pressure. So as they will increase, they will develop more demand of blood. There will be more myocardial blood demand, but the supply will be not as much as the demand is there. So there will be myocardial demand and supply mismatch, and that can also cause a myocardial ischemia, and ultimately may lead to the heart failure also in these patients. So this is a broader term which encompasses heart failure as well as the myocardial ischemia.
Okay, sir. So basically, it compasses of all the stages of heart disease,
Bilkul.
starting from atherosclerosis, ischemic heart disease, stroke to heart failure. So basically, this brings up to another question for Dr. Puru Tyagi. Since you already described about the progression of hypertension to chronic kidney disease, can you just help us with the different stages in which it can affect and leading to the progression of chronic kidney disease?
Right. So what happens is, like I already discussed, that first of all, it makes the kidney work harder. Now, in scientific terms and medical terms, if I have to say, it causes the shrinkage of the glomeruli, which are the units of the kidney. And this basically decreases the number of glomeruli which are there in the kidney. And we have to remember the fact that kidneys, once we are in the adult stage, they cannot grow new glomeruli. Okay, they cannot sprout new glomeruli. So we are, all of us are left with a certain number of glomeruli. And if these number of glomeruli keep on decreasing with hypertension, then eventually we'll be in a stage where the kidney is not functioning properly. Second thing, what happens is that once a particular set of glomeruli come down, once they go down, then the effective load of those glomeruli that is shared by the other glomeruli which are remaining intact, and now they have to work harder to meet the requirements of the body. So in a sense, there is an increased pressure on these glomeruli as well. This is one of the reasons why blood pressures are control of the blood pressure is a very, very important factor in the preventing the progression of kidney disease. And it can affect all the stages of kidney disease. In fact, if we control the blood pressure, we might see a slowdown in the progression of kidney disease, or we might even see a reversal of the kidney disease. I mean, sometimes there is an acute on chronic kidney disease taking place because of uncontrolled hypertension. And if we control the BP effectively, then we frequently see that the creatinine of the patient, which is how we measure the kidney function, so that creatinine value will come down. So in a sense, this is how it works. This is how it affects the kidneys.
Okay, sir. So basically, the glomeruli starts damaging, and as and when it starts damaging, it leads to the progression of chronic kidney disease due to the
Yes,
increased
exactly.
pressure on the kidney. Yes, sir.
Exactly.
So when we spoke about the different stages of cardiovascular disease, sir, you must be seeing a lot of patients with established cardiovascular disease with the associated hypertension and heart failure patients. So what is the optimal blood pressure target that these patients should maintain?
Actually, there are two school of thoughts. Actually, we follow the two major guidelines according to ACC/AHA, American Heart Association, and European Society of Cardiology (ESC) guidelines. So, regarding the initiation of the treatment, both the guidelines differ, and targets are more or less similar in both the guidelines. With the normal population, targets are generally decided less than 140 systolic and 90 diastolic blood pressure. But if a patient has a established cardiovascular disease and he is in heart failure and has developed myocardial ischemia and he is on therapy and has hypertension also, then the targets are sometimes lower than the general population. Then targets in the established CVD are less than 130 millimeters of mercury for systolic blood pressure and diastolic blood pressure for 80 millimeters of mercury. So they should be maintained in the lower range, as these has been studied in various trials like Sprint, Accord, and they have studied the better morbidity and mortality rates in the patients who have better control of blood pressure as compared to the normal subjects. And normal blood pressure ranges less than 140/90. These patients had better rates of morbidity and mortalities.
So in a nutshell, if we have to say that they have to maintain a tight control on their
Yes,
hypertension.
yes, yes.
Dr. Puru Tyagi, I would like to ask for the patients who are on dialysis, how regular they should get their blood pressure checked.
So it's a very important question, and I'm glad that this question has come up in this talk. What happens is that the only time dialysis patients are getting their BPs measured is when they actually come for dialysis. All right. And when the BP monitor is attached to them while they are getting the dialysis done. So that is actually the worst time to take a BP for a dialysis patient, because BP can be very high, BP can be lower than normal during the dialysis. Okay, and it all depends on different types of patients and what is the UF we are removing and everything. So for especially for dialysis patient, for example, what we follow in our center is we have a lot of mobile automatic BP machines, and we keep on circulating these machines amongst our patients. And what these patients do is they measure the blood pressure, 3 to 4 times a day, and then they come back to us with the readings, and then we see, what is the majority of the blood pressure that is there. So in dialysis patients, the dialysis patients suffer problems not because of the kidney anymore, because the kidney is already taken care of by the dialysis machine, but because of the heart. So, like Dr. Sab said that we should keep a target of generally less than 140/80, and I don't want to go into the complexities of it. So I would say that yes, we should keep a target of less than 140/80. And just to extend on that thought, I would say that less than 140/80, but more than 110. And the reason for this is because it has been found that if we go really low, if we go, for example, the systolic blood pressure, which is the upper wala blood pressure when we measure the BP, if that blood pressure goes below 110, then there can be problems for the patients when they are in their homes. Secondly, for elderly patients, we tend to keep a more liberal target, and I sometimes keep it 140 150/90. I sometimes allow it to go to 160, and I also have a close watch on the diastolic BP of these patients, which is a niche wala BP. And the reason why I have a close watch is because if the diastolic BP falls too low, then frequently the elderly patients will have a chance of a fall. And a fall is probably, the worst thing that can happen to an elderly patient, because they have such high risk of fracture and it compromises with their quality of life. If we talk about what ideally should be done, so ideally we should have an ambulatory blood pressure monitoring done for all the patients of dialysis every month, at least. Every month, one day, we should give an ambulatory BP monitoring machine to the patient, which keeps on tracking your BP throughout the day, even while you are sleeping. And then it gives us a graphical representation of how the BP is. So sometimes what happens is the BP can be completely okay throughout the day and it can only rise during the night. And sometimes it can happen that, only when at a particular time the BP might be rising, which we may not be otherwise recording. So ABPM should be done at least once a month, but actually ABPM machines are not very readily available. And so the second best option is keeping an automatic BP machine at home and measuring it 3 to 4 times a day. That's from my side.
Actually, home BP monitoring must be the better option for the patient as compared to the.
Right. I agree with sir.
This is a very important point that you highlight. Usually, in the patients who go for dialysis, they just check in the center and ignore the fact that it has to be monitored so tightly, as mentioned by you. So, this is something which even the doctors, the dialysis centers, assistants should always keep it in mind and guide the patients accordingly for the same.
Correct.
And sir, coming to you, Dr. Abhishek Kumar, as rightly mentioned by both of you, we come to know that hypertension is a major, risk factor for both the disease, and it is so linked to each other that even a cardiologist and a nephrologist have to be hand in hand for the management of hypertension. So, sir, if
Def-
you can highlight some of the traditional risk factors as well as the other risk factors associated and who are at the higher risk for developing hypertension.
Actually, traditional risk factors can be divided into the modifiable and non-modifiable. Some are non-modifiable in which we cannot do any modification. They are like genetics. If familial hypertension is there, parents are having hypertension, both the parents have hypertension, then there are more chances of getting hypertension in the childs also. And increasing age. If patient is increasing in age, and it is also a risk factor for developing hypertension because increasing age increases the stiffness of arteries, and that can cause hypertension. And some are genetic causes. Others are like some are the syndromes like Gordon syndrome, Liddle syndrome, essential hypertension. These are syndromes which are associated by birth, and you cannot modify them. So these also can lead to the hypertension and further lead to the development of CKD and cardiovascular diseases. And some are modifiable risk factors in which we can have some intervention and can modify them and can prevent the development of hypertension and further deterioration. So these are like smoking, obesity, diabetes, physical inactivity. Most commonly these days, we are encountering the hypertension in young population. And two major risk factors are smoking and physical inactivity. And third one is diet. So consumption of more of salt and saturated diet, as we are into more of fast food and cold drinks, energy drinks, and these can lead to the development of hypertension in young population also. And some are unconventional or the specific risk factors like patient has hypercoagulability. So patient may have some deficiency of anti-thrombotic factors like protein C, protein S deficiencies, hyperhomocystinemia if patient has high levels of homocysteine, then also can have patient develop hypertension and the risk for cardiovascular diseases. So in these, we cannot modify them, these
So
cases.
this was very comprehensive. You highlighted all the risk factors, both the traditional and the specific risk factors. So with this, so we come to an end of the session where I would like both of you to highlight and summarize the key take-home message for the audience. Just to tell you that we have patients as well as the general public and the caregivers who have joined us for this session. So if you can highlight some of the points, a message to the audience in Hindi as well as in English. So starting with Dr. Puru Tyagi, your message for today.
All right. So, what I would like to say to, first of all, the patients who are affected by the disease is please don't take your disease lightly. Okay, hypertension is not going to affect you in a day or two, and it is not going to cause any problem probably in a few months also. But a few years down the line, you will start to see the effects. And once we start seeing the effects, then there is no turning back. So this is the right time to start looking into your hypertension. And the most important way to address this challenge is to basically measure the BP. Measure it, record it, see it with your eyes. Once you start measuring it, then definitely you are going to take some action about it. And my message to the general population in general is that, please, at any given opportunity, check your BP. There is no age at which hypertension cannot come. It can even come in childhood. And we have to be really careful about developing these kind of diseases which can affect our lifestyle, and it can also indicate some underlying deeper problem. तो
Thank you so
ध्यान
much.
रखिए, अपना स्वस्थ रहिए. जी जी, just to go about it in Hindi is that
Yes, sir. Yes.
चकित सतर्क रहिए, है ना. मतलब जितना हम सतर्क रहेंगे, जितना हम उसको नापेंगे बीपी को, उतना ही चांस है कि हम अपने बीपी को कंट्रोल कर पाए. नॉलेज इज पावर, है ना. अगर हम बीपी को नापेंगे तो कंट्रोल कर लेंगे.
Definitely.
Thank you, sir. Dr. Abhishek, your message.
Very well said by Dr. Puru also, that BP is a silent killer and we have to measure it regularly. And a family consists of all age peoples, like we have children also, teenagers, middle-aged peoples, old-age peoples, and this is not necessary that old-age peoples are required to measure BP only. The middle-aged peoples and even the teenagers are required to measure their BP because of the environment and the diet we are having in nowadays. The diet we are having today and the physical inactivity is leading cause of young hypertension in patients, and young patients in 20s 30s are developing hypertension. So it is necessary that every member of the family measures BP regularly, or at least once in a 15 days, once in a week, they measure their BP, and just they should control their BP for healthy life, healthy soul, healthy mind. The hypertension should be controlled. That's it.
Thank you so much, sir. So, on the occasion of World Hypertension Day, with this initiative of Tell Me More, we had Dr. Puru Tyagi and Dr. Abhishek Kumar. So, I would now like to propose a vote of thanks to Dr. Puru Tyagi and Dr. Abhishek Kumar for joining in despite of their very busy schedule. It gives me immense pleasure to have both of you on this platform, sir. It was a very outstanding deliberation and an insightful talk. And I'm sure with this, the audience will take some messages from this and apply in their day-to-day routine. And with this, I would also like to thank our audience who have joined us today for this particular session. And we look forward to taking this initiative ahead and, defeating hypertension before it defeats anybody. So thank you so much. Thanks a lot for joining in.
Thank you.
Thank you so much. It was an honor to be here.